Hi guys, welcome back to the channel. Last class we have started with primary hyperparathyroidism. We have seen that it is mainly caused by the hypersecretion of parathyroid hormone. Main feature is hypercalcemia. Sometimes brown tumor and nephrocalcinosis is seen. It is more common in women and who are older than 50 years. And idiopathic hyperplasia and sometimes associated with MEN1 and MEN2A. Then we have seen that PTH increases serum calcium level by increasing osteoclastic bone resorption, reducing renal excretion and increasing calcium absorption. Then we have seen the hypercalcemia related signs and symptoms. Mainly that was thirst, nausea, vomiting, constipation, weight loss and all. And we have seen when it is severe as in it is more than 15 mg per day, it will lead to confusion, depression, fatigability and muscle weakness. Okay, let's start today's topic. Coming to bone related signs and symptoms. Bone pain is the main symptoms and occur primarily in vertebrae, tibias and joint. Kyphosis and multiple small vertebrae fractures leading to loss of height. Now, radiolucencies, brown tumor, may develop in bones, commonly in jaws, or a diffuse demineralization, sometimes called osteitis fibrosa cystica. Okay, bone related signs and symptoms में दो चीज़ हम लोग को radiographically we can appreciate, that is brown tumor, radiolucency, and second thing is diffuse demineralization, that is known as osteitis fibrosa cystica. And the symptoms are bone pain, kyphosis and multiple small vertebral fractures. Okay, these two will be present as histologically it will be seen. These two, brown tumor and osteitis fibrosa cystica, will show fibrovascular stroma replacing mineralized bone, while giant cells which are presumably osteoclasts are seen resorbing bone. Okay, एक तो फाइब्रोवास्कुलर स्ट्रोमा हो जाएगा, मिनरलाइज बोन नहीं रहेगा और जाइंट सेल दिखेंगे. वो जाइंट सेल कौन से हैं? वो ऑस्टियोक्लास्ट सेल्स हैं जो कि बोन रिजॉल्व करते हैं. ये दिखेगा हम लोग को. देन these areas appear as a friable red brown mass, hence the term brown tumor. Subtle changes in trabecular bone pattern resembling age-related osteoporosis are common. Rarely tooth mobility or loss of lamina dura is seen. These all are bone-related signs and symptoms. Brown tumor क्यों कहते हैं? Because it appears as a variable red-brown mass. Okay, that's why it is known as brown tumor. Now, urinary tract-related signs and symptoms. First is polyuria, increase in urination, and polydipsia, increase in thirst, are related to hypercalcemia, and they are urinary tract related signs and symptoms. Renal calculi in ureter or calcification within the renal parenchyma, that is nephrocalcinosis, are deposit of calcium oxalate or calcium phosphate. Obstructive nephropathy or nephrocalcinosis leading to renal failure. Nephropathy and nephrocalcinosis will lead to renal failure. These are urinary tract related signs and symptoms. Polyuria, polydipsia, renal calculi, nephrocalcinosis, obstructive nephropathy. These all are urinary tract related signs and symptoms. So, in primary hyperparathyroidism, we have seen three things. Firstly, hypercalcemia related signs and symptoms. Second is bone related signs and symptoms. Third is urinary tract related signs and symptoms. Now, coming to differential diagnosis. First is multiple myeloma, then hypercalcemia of malignancy, sarcoidosis, vitamin D or calcium over ingestion, ज़्यादा खा लिया vitamin D और calcium, और adrenal insufficiency. Third is adrenal insufficiency. Okay, that's all for today's class. Next class will be starting with histopath and treatment part of the hyperparathyroidism. Okay, till then, like, share, subscribe and comment. Bye.